Today, I would like to present on the effect of COVID-19 on blood donations. However, before we get started, here is a little bit about me. My name is Krisha Thakker, and I'm a 16-year-old student at Westview High School in San Diego, California. For some of my extracurricular activities, I am the co-founder of SOS Incorporated, a student-led national nonprofit and Riley's Way Fellow that aims to support teenagers with their mental health struggles through connection and empathy. I am also the founder and president of MEDX, a school medical club that educates our community about medical topics through international and domestic medical financial aid and awareness campaigns. I also blog on my website, My Science Nook, and in the future, I hope to become a pediatric oncologist. Here is a quick overview of what we will talk about in this presentation. First, I'd like to introduce this topic to you in a game of Find the Connection to highlight the importance of this topic. Next, I'd like to talk about a few statistics to underscore how serious this problem is. I'll then discuss why this problem occurs. And finally, I'll go over what you as the viewer can do to help alleviate this problem in your own community. First of all, what are we talking about and why is this important? Take a few seconds to look over these diseases and their definitions. What do you think they have in common? A need for blood. That's what connects these 4 diseases and countless more. They all could require blood transfusion to help keep their patients stable and healthy. The need for blood is universal and extremely critical. In fact, here are 3 astonishing numbers to highlight just how important blood is in the medical field. 100 pints is the amount of blood one car crash victim could require to keep stable. 2 seconds. Every 2 seconds, someone in the US requires blood transfusion. And 1 million. That is the number of people diagnosed with cancer each year. Most of those patients will require blood, sometimes daily, during their chemotherapy treatment. We've seen how important blood is in the medical field. However, there is a major problem as shown with statistics. In a study published in 2019, hematologists showed that 119 out of 195 countries didn't have enough blood to meet their respective demands. Against the demand of about 305 million blood product units worldwide, blood banks only had a supply of a little over 272 million units. That is 32,441,001 units desperately needed but unavailable, resulting in a potential loss of countless lives due to the shortage of blood units. COVID-19 has made the situation worse. Globally, the results are alarming. In Ethiopia, donations fell to just under 30 a day after COVID-19 hit. In India, voluntary donation fell by almost 100%. And in Turkey, donations fell by over 75%. Meanwhile, demand has increased. Patients with diseases like cancer, anemia, and hemophilia still need the same amount of blood, while COVID-19 patients now need plasma to battle the virus. This imbalance puts further strain on the system and creates a risk of losing thousands of lives. So why does this happen? People donate money to charity all the time, so why not donate blood? The reason behind this is simple. The importance of donating blood is just not fully understood. In fact, in some countries, donating blood is frowned upon. Factors including illiteracy and superstitions cloud views on blood donation. Worldwide, lack of sustained awareness campaigns also encourages the spread of false information, such as the misconception that donated blood isn't replaced in the donor's body, or that donating blood can cause HIV, etc. Recently, myths about catching COVID-19 at blood banks and becoming infected from blood transfusions run rampant. As social distancing, and it becomes so much harder for blood banks to collect enough blood to meet the demand. Traditionally, to increase donor rates, blood banks have used technique number 1 shown in this chart, material or monetary incentives. This includes things like offering gift cards, t-shirts, paid time off work, etc., to entice people to donate blood. However, this has been proven to be ineffective. Data has shown that this doesn't actually increase donor participation. For example, the American Red Cross has offered all of the above-mentioned incentives in an effort to increase donation rates. But donor participation has not significantly increased. In spite of incentives, only 3% of eligible adults in the US donate blood. So, how do we do this? How can we encourage thousands of people worldwide to donate blood, especially during a pandemic? This is where use of data comes in. Research suggests that leveraging demographic data and tailoring campaigns towards specific populations increases donor participation. For example, in St. Louis, blood banks tried to reach African American donors by partnering with community members to host 34 blood drives at 13 churches. This campaign was reported as extremely successful. In 2016, the National Health Service in the UK used a different tactic to increase donor participation. It launched a social media campaign in the UK targeted to a certain age range, successfully encouraging 30,000 people to sign up to be new donors, who in turn also created 27,000 tweets to encourage others to do the same. By combining these techniques with techniques already practiced, blood banks can increase donor participation by focusing on the benefits and importance of donating blood, eradicating any misinformation, and highlighting safety precautions taken to protect donors during the current COVID-19 pandemic. But blood banks don't have to do this alone. Blood donation is a social cause and not just a blood bank charter. We don't have to be superheroes to save a life. You can do that by donating blood. Age restrictions to be a donor vary from state to state and country to country. However, in the US, most states have the minimum set around 16 to 17 years old. You can find the age restrictions for your state or country by searching up the phrase age to donate blood and inputting your country or state. Not only is donating blood good for you and your heart, but one donation can save up to 3 lives. If you're not old enough to donate yet or have an issue that prevents you from doing so, you can still help by spreading the word. As we saw, social media is a great tool to generate donations, and you can help your local blood bank run by offering to volunteer there as well. These are the sources that I used for my presentation. And thank you so much for giving me your time. Make sure to look up your nearest blood bank and start making a difference in any way possible. Once again, thank you so much.